everyone. Today we are going to talk about the polycystic ovarian syndrome. So what happens in this polycystic ovaries? This is usually seen in females who are heavier or who have a higher BMI. So what happens in heavier individuals? In heavier individuals, they develop an insulin resistance. Why should they develop an insulin resistance? This is because they have excess of adipose tissue, right? Moreover, they also have a visceral fat. These visceral fat will release chemicals which is capable of inhibiting the insulin. There are numerous mechanisms for why heavier individuals have hyperinsulinism or insulin resistance, and this is one of such mechanisms. So they are capable of inhibiting the insulin. So the insulin will be to act in these individuals, because of which there will be a hyperinsulinism. Pancreas will sense even though how much ever insulin we secrete, it is not being able to act on the tissue, so that it will start secreting even more amount of insulin. This will result in hyperinsulinism. Once a hyperinsulinism occurs, there is a delicate balance between the hypothalamus and the pituitary. What happens? The hypothalamus will be releasing a gonadotropin releasing hormone, which is also known as GnRH. What are the gonadotropins? The FSH and the LH are the gonadotropins. So follicle stimulating hormone and LH is the gonadotropins. They should adequately come and it will result in ovulation, right? But if there is hyperinsulinism, this delicate balance is disrupted. It will result in abnormal secretion of GnRH. Normally, normal secretion will not be there. Abnormal secretion of GnRH will be there. When there is an abnormal secretion of GnRH, it will result in abnormal release of FSH and LH, such way that the LH will be increased but the FSH will be decreased. Generally, if you see in books, this will be truncated as increased LH FSH ratio. Okay, so but you need to know that the LH is increased and the FSH is decreased. Once LH increases, so what is the role of LH? The LH is capable of acting on the, if this is the ovum, and here we will be having the granulosa cells, and here we will be having the theca cells. Here we will be having the theca cells. Theca interna and theca externa are there. Let's not go into details. So here we have the theca cells, and these are the granulosa cells, and this is the ovum, which is yet to get released. So normally what will happen, this follicular stimulating hormone will stimulate this follicle. This is a follicle. So from a small stage, it will grow and it will grow and it will grow and it will grow such that it becomes a mature follicle and the ovum will be released. Similarly, the LH, what is the role of LH? LH will act on the theca cells and the theca cells will start producing the androgens. Fine. So here in this case, in PCOS, what happens? The LH is increased. Therefore, it will act on the theca cells and the androgens are produced in excess amount. Since the androgens are produced in excess amount, it results in hirsutism in the patients. And again, what happens? The FSH is decreased. Because of a decrease of the FSH, the granulosa cells, this follicle is not formed aptly because the FSH is not reduced. What is the full form of FSH? Follicular stimulating hormone, right? It is supposed to stimulate the follicles and it is supposed to cause the ovum release. But the follicles are not developed adequately. Therefore, this ovum is also not released. Ideally, normally, what should happen? Once this ovum is released, we will be having only a cell with theca cells as well as the granulosa cells, and there will be no ovum at all. Okay, the ovum will be released. This is known as the corpus luteum. The corpus luteum will be releasing the progesterone. This is what happens normally. But in this case, where the follicle is not being developed properly, the ovum is not released, and this will turn into a follicular cyst, just a cyst. Okay, and this will become a follicular cyst. So now, so therefore, in these patients, we will be having a follicular cysts. Fine. So before we saw that there will be an ovulation, and in addition to it, there will be follicular cyst also formed. According to the Amsterdam criteria, you should know that there has to be more than 11 plus cysts bilaterally to call the patient as polycystic ovary, to call the ovary as polycystic ovary. But that is not important in US only, they don't generally concentrate. So the patient will be having hirsutism, patient will be having anovulation, the patient will also be having cyst. So this is how a patient who are heavier females or who have high BMI, who are again having PCOS, will present in this condition, right? And one thing which you need to know is insulin resistance, mostly it happens in a female with higher BMI, but not necessarily. Those who are lean individuals also can develop insulin resistance, and those who are heavier may not also develop insulin resistance. It depends upon the body framework and the genetic makeup of that individual too. So this is in a nutshell about the PCOS. Thank you for listening. Have a good day.